Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know that I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For WhatsApp number for paid online consultation 92268 This is the video related with our series that is going on Ayurveda in GP or Ayurveda in general medical practice. Somebody is looking this video first time, they must check all the playlist of that Ayurvedic treatment in different diseases. This is the name of the playlist. Ayurvedic treatments in different diseases. So you see there are nearly 80 videos and every video is fantastic video. So you will be definitely get benefited by increasing your what you can say the status of the knowledge. So I wish all the best and I am very thankful for your kind support to my channel. So skin diseases part 2, this is the topic. Let us start to discuss the problem. We have already covered in the first part. Please check the first video. Scabies, ringworm, leukoderma, finish, eczema. Now we will start with the acne disease. So acne is a name, acne vulgaris. And Ayurvedic terminology is a mukha dushika. If you have not seen the first part of this video, let me tell you, in Ayurveda, for all types of skin diseases, the terminology is Kushtha is the word. Kushtha is not leprosy in Ayurveda, my dear friend. Kushtha means all types of skin diseases. The major problem is Pitta Prakopak Ahar Vihar. Hot, spicy, pungent food, irritating food, dahak, vidahi, inflammatory type of the food stuff. All the vices, alcohol, smoking, nicotine, etc., keeping late at night, increase the screen time, each and everything will make worsening of your skin problem. It may be acne, it may be eczema, it may be psoriasis. I have the separate video, sir. In this series, psoriasis is not there. Yes, I know, because it is already a total fantastic separate video in Hindi language is available on my playlist Ayurveda in what you can say the Ayurvedic management in different diseases. Okay. So acne here, Mukha Dushika in the young age. It is a common inflammatory disease of the pilosebaceous follicle. So sebum secretions to make our skin little bit oily. But if it is too much oil is coming out and the pores are blocked, then infection, secondary infection starts. Seen in the adolescents, 18, 19, 20, characterized by the comedones, which are secondarily may be infected, resulting in papule, pustule. Pustule means pus inside, cyst, nodules, and the scars. There are different types of acne: mild acne vulgaris, acne papulosa, acne indurate, acne cystic, acne atrophica, and acne, oh my God, keloids. Next, the treatment in Ayurvedic management. Ayurveda for all types of skin diseases, I recommend for any skin disease, if you are the indicated patient, then I will recommend the detoxification management is must for any skin diseases. The other Ayurvedic advice is that shodhayet punah punah. Repeatedly, shodhana prakriya, detoxification of the body is very essential, especially therapeutic vomiting, that is vamana chikitsa, therapeutic, what you can say, the purgation, that is a virechana chikitsa, rakta mokshana chikitsa is the best to remove the impure blood from the body. So whenever possible, you please visit to the nearby Vaidya if you are suffering from any skin diseases and get your body purified. If you have any problem and if you are nearby Pune and if you want to come in our different clinics, everybody is asking, sir, where is your hospital? Sir, where is your clinic? I am working with the team of doctors. Dr. Deshpande is the leader, coordinator, and director. Try to understand. So we work with the different hospitals and different clinics, but we will make a best management by Professor Deshpande. This is my guarantee to you. Okay. So anyway, we were discussing Shamana Chikitsa, palliative treatment, Thiostanin blood purifier from Ayurveda Rashala Company, Pune. 2 tablets 3 times in a day. Kamadudhavati, anti-pitta, pitta shamana chikitsa, 2 tablets 3 times in a day. Prasham for anxiety, to relieve the stress. Stress management drug from Ayurveda Shala Pune, Prashama, liquid and tablet, both are available. 2 tablets 3 times in a day. Shankha Bhasma, very specific for acne, Mukhadushika, 200 to 500 milligram 3 times in a day with milk. Local application here, Shalmali bark. Shalmali bark powder is available. 10 gram, Vacha 5 gram, fine powder. Yashti Madhu 5 gram and red gram flour 20 milligram 20 gram, mix it very well and apply with the honey or with the ghee. Okay, next. Another prescription separate. This is not the continuation. Another prescription. Kanchanara Gugulu, if it is a cyst or like a pushchul, then Lekhana Karma, Kanchanara Gugulu, 2 tablets 3 times in a day. Again, for cystic and nodular eruption, Punarnava, anti-inflammatory. Gugulu, 2 tablets 3 times in a day. Blood purifier, Kaishora is a Guduchi, Tinospora cordifolia, Kaishora Gugul, 2 tablets 3 times in a day. Local application, Zephyr and Rakta Chandana. This was second prescription. Now I am telling you third prescription. Dr. Deshpande is giving a lot of medicine which can be used in our GP. Rakta Prabha, 2 tablets, Sandu Company, 2 tablets 3 times in a day. Kamadudavati, Hari Parashuram Aushadhalaya, Pune City, Maharashtra State, from Vaidya Khadiwale Vaidya, 2 tablets 3 times in a day. Chandanadivati, sandalwood, Thanda, cool, 2 tablets 3 times in a day. Then Shankha Bhasma, very specific in Ayurveda for Mukhadushika, 125 milligram 3 times in a day. Locally, you can get a leech application, Jalauka Avacharana, best treatment. Local application of Suvarna Mukhi Lep from Hari Parashuram Aushadhalaya of Khadiwale Vaidya, Pune Pharmacy. Local application of Amalaki and Raktachandan and Nagarmotha. Nagarmotha is the best Amapachak. So, Pathya regime, face wash repeatedly for 3-4 times with the lukewarm water and using the Medimix soap 3 to 4 times in a day. Avoid the oily and fatty food. Regular, wholesome diet as per the digestion capacity. Of course, the food should be comprised of green leafy vegetables, fruit vegetables and fruits. Good night sleep, very essential. And regular bowel movements, stools should be perfectly normal. Remember, if your stools are, if you are constipated, remember my words, your skin disease will not be get cured permanently. No. So your stools should be absolutely normal. Daily once or two, but should be very clear. Because Rakta Shuddhi, heat is generated if you have the constipation. This is the thing that you must understand. Always we give the importance to the ointment. Say, sir, write me some ointment. Sir, write me some tablet. Nothing. You have to take a detailed case history, find out the exact causes, where is the problem, and then we treat it. This is the specialty of Ayurveda, my dear friends. Urticaria. Acne vulgaris disease finished. Now I have started the next disease, that is urticaria, skin rash, allergic skin rash. Okay, this is a common condition characterized by the wheals on the skin occurring on any part of your body. Wheals. Okay, they are intensely pruritic, itching, lasting less than 48 hours. When it occurs at the submucosa or the deeper dermis and subcutaneous tissue, it is called as angioedema. Most of the times, very severe allergic reaction with the injections, with the tablets. Then you get the lip swelling, that is angioedema. It is produced by an increase in vascular permeability and extravasation of the proteins and fluids from that blood vessels. Types, urticaria types. Can you see my cursor, my dear friends? This is cursor. Allergic, acute, allergic urticaria, acute or chronic. Non-immunologic urticaria, cholinergic urticaria, and dermatographic lesions. Now, causes, there may be infections, for example, with bacteria, fungi, viruses, protozoa, or intestinal parasites. Ingestants, food like shellfish, prawns, strawberries, eggs, nuts can give you allergic reaction. Inhalants, feathers, even animals, hair, dust, spores, and cosmetics. These can be the cause of urticaria. Find it out. Inject injections, like for example, antibiotics, then anti-sera injections. Just a moment, my dear friends. Antispasmodic, like tablet Baralgan, then analgesics and vaccines. All these can act as an allergen. Okay, drugs like medicines, side effects, bites, mosquito, fleas, bees, etc. Systemic diseases in your body like lymphoma, internal malignant mastocytosis, jaundice, malaria, rheumatic fever, any disease can provoke the urticarial rash. And last but not least, psychogenic. So psychogenic point is also important. Now, what investigations you can do? Hemogram and ESR to rule out the anemia. When hemoglobin normal should be 12 to 14 gram percent. If it is below 10 gram, you are anemic. Pandu Vyadhi in Ayurveda. Acute and chronic infections, WBC count normal, 4 to 11,000 per cubic mm. If it is 15,000, mild infection per cubic mm. 20,000 per cubic mm, moderate infection. 25,000 WBC count, soldiers, severe infection. Absolute eosinophil count. Normal eosinophil count, less than 5% cells should be there. But whenever there is allergic urticaria, eosinophilias are always raised. There are 5 types of WBCs: neutrophil, eosinophil, basophil, lymphocyte, and monocytes. Okay. Then stool examination to rule out the worm infections: roundworm, threadworm, hookworm, tapeworm, amoebiasis, giardiasis, etc. Allergic testing, but I personally don't go for that. It is very less useful. Rule out the cause and treat specifically. For example, if the child is having intestinal worms, treat the anti-helminthic treatment should be given. Local application of the black pepper on the urticarial rash with the ghee. Local application of kokum, garcinia, water or sandalwood paste. Chodhana chikitsa, Vaman or Virechan or Raktamokshan. For symptomatic treatment, you can give the Sutta Shekhara Rasa Sadha, 2 tablets 3 times in a day. Chandra Kalaras, Thanda Thanda, Cool, anti-pitta management, 2 tablets 3 times in a day. Mauktik Pearl, Kamadudha, 100 milligram plus Khurasani Ova for psychological settlement, anti-stress, and local application. What is that? Dah Shamak Malam, Ayurved Arkashala, Satara. Next. Another prescription for urticaria: Laghu Malini Vasanta, 3 to 4 tablets 3 times in a day. Laghu Sutta Shekhara Rasa, Sama Pitta treatment, 2 tablets 3 times in a day. Praval Pishti, Pitta Gna Chikitsa, Antipitta, 2 tablets 3 times in a day. Triphala or Avipattika Churna, 1 teaspoon at bedtime with the warm water to get the fantastic stools. No constipation. Body heat, Pitta heat will be gone, go away from the stools. Next prescription for urticaria: Suvarna Sutta Shekhara Rasa for chronic cases. 1 year old, then you can use the gold as a rasayana. 1 tablet 2 times in a day. Artiplex from Charak Company, 2 capsules 4 times in a day. Arvindasava, Thanda Thanda, Pittagna. Arvinda is a lotus. Arvindasava, 4 teaspoons with equal amount of water 2 times after meals. Urticaria disease discussion finish. Next skin problem, recurrent boil, abscess. Okay. The causes may be diabetes mellitus. Immediately check the blood sugar, poor general health, malnourishment, blood dyscrasias like ITP, idiopathic thrombocytopenic purpura, chronic nephritis, kidney problem, immunoglobulin deficiency, that is immunity will be weak, low immunity, and unhygienic conditions. What investigations you must do? Blood sugar fasting and postprandial if the patient is non-diabetic. If not non-diabetic, fasting and post-glucose. Also, there is important for both cases, HbA1c, glycosylated hemoglobin, gives the average blood sugar in the last 3 months. Okay. Renal function test, urea and creatinine to rule out the kidney problem. Hemogram and ESR to rule out the acute and chronic infections. Neutrophil count more, acute infection. Lymphocyte count more, lymphocytosis, chronic infection. Hemoglobin 12 to 40 gram, less than 10 gram, that is anemic condition. Treatment: recurrent boil, rule out the cause and treat accordingly. If systemic causes like diabetes, treat controlled sugar. Importance of hygiene should be taught, and wounds must be cleaned 2 times in a day with Triphala Kvath or Haridra Kvath. Sukshma Triphala tablet like Ayurvedic antibiotic, 2 tablets 3 times in a day. Blood purifier, thyrostatin, Ayurveda Shala Pune, 2 tablets 3 times in a day. Sari Vadyasav, that is Anantamool, anti-pitta, pittagna treatment, 4 teaspoons with equal amount of water, 2 times in a day. Next prescription for recurrent boils, Chandrakala Rasa, 2 tablets 3 times in a day. Can you see the cursor? Pravar Pishtivati Hari Parashuram Aushadale, Pune city from late Khadiwale Vaidya, 2 tablets 3 times in a day. Khadirarist astringent Kledanashak, 4 teaspoons with equal amount of water, 2 times after meals. Panchatikta Grita Gaggalu, bitter test is blood purifier. So Grita is given, Gugulu is given as a preventive measure to avoid the recurrence. So it's like a rasayana tonic early in the morning on empty stomach, 2 teaspoons with water. Anant, that is a Sariva Churna, 1 gram once in the morning with warm water. Recurrent boil, Pathyapathya, do's and don'ts. Avoid the Pitta Prakopaka, food and lifestyle. Stay away from spicy, sour, and hot food. Regular bowel movement should be seen. Use of dried clothes. Cleanliness and hygiene are the most important things. Recurrent boil problem discussion finished. Next problem, dandruff. In Ayurveda, it is called as a Darunak. Okay, so Sukshma Triphala 2 tablets 3 times in a day. Thyrostatin, Ayurveda Shala Pune, 2 tablets 3 times in a day. This is one prescription. Another alternative, here you can add the Panchendriya Vardhana Tail for Nasya. Any Urdhvajatrugato Vikareshu Visheshat Nasya Mishyate. Problem related with the face, ENT, brain, skin, hair, etc., scalp hair, etc. Always use the Nasya. Then for hair falling, if there is a Darunaka, dandruff plus hair falling, then you can use the Kesha Vardhana Tail, Ayurveda Seva Sanghanashik, or Bhrundaraja Tail, Ayurveda Seva Sanghanashik, for gentle massage. Or for if there are lice infection, then Karanja Tail application for the scalp. Hair wash with anti-dandruff Ayurvedic hair shampoo and application of lemon juice 2 times in a week you can do. Use of Shikekai and Rita for hair washing and proper hair hygiene. This disease is finished. Dandruff finished. Next problem, pruritus ani, that is anorectal region. Gudakandu is there. Pruritus, itching is there. Causes threadworms, proctitis, hemorrhoid, that is piles, anal fissure, broad spectrum antibiotic, and side effect of that long-term broad spectrum antibiotic, neurodermatitis can be the cause. Treatment, find out the cause and treat accordingly. If you find the piles, treat the piles first. If you find the fissure, treat the fissure first. If you find the worms, give the anti-helminthic treatment. Now, if the pruritus itching is because of the worms, use the Krimi Mudgara Rasa 2 tablets 3 times in a day. Vidangarishta 4 teaspoons with equal amount of water 2 times after meals. Laghu Malini Vasant 2 tablets 3 times in a day. Then Sukhasaraka Churna for the normal stools, 1 teaspoon at bedtime. If fissure of the palms and sole, you can apply Padadari Malam, Ayurveda, Rasashala Pune. Pathyapathya regimen, proper hygiene and anal region, especially after each motion. Cut nails, always nails should be cut, and avoid itching near the anal region. Children usually they such type of activity. Undergarment should be comfortably loose and dried enough. Wart, next problem is wart, but we cannot do in our practice mostly. Local application of Sarja Rasam Malahar, Hari Parshuram Aushadale, Pune city from late Khadiwale Vaidya. Electric cautery may be done internally Arogyavardhini or Kanchanal Gugulu to avoid the recurrence. My dear friends, this was the discussion Skin Diseases Part 2 in the series of Ayurveda in General Medical Practice. I wish all the best. Please like, share and subscribe my YouTube channel to boost my energy. Thank you very much. I wish you all the best. Take care and we will see you in the next video.